My name is Dr. Lucian Gergus. I'm from Romania and I am based in the bank surgery Sălbi. I always wanted to work in a GP practice, but because of the system, I didn't have a chance or opportunity to join any practices back then. So I had to do different jobs in different hospitals across the UK. GP practice is the best place to work in my case. I like the fact that I can provide continuity of care to my patients. I can deal with all sorts of medical problems, and ultimately I think this is the most important aspect of my job. First of all, you need to have a GP qualification from your own country or an equivalent qualification from your own country. Once you move in the UK, you need to register with GMC. And after all this process is finished, you need to be on the national performance list in order to be able to practice as GP in the UK at present. I had an ongoing training, English training. I have clinical supervision sessions where I get feedback and support for the patients and cases I'm seeing. We have access to online resources, and every week we have ongoing training with NHS, organized by NHS.
I think there's a general lack of awareness by the public about how difficult it is in general practice to recruit at the moment. I've been here for probably about 10 to 12 years, and increasingly we've seen it being harder to recruit GPs. So having tried to recruit for a few years, when the international GP programme came along, we were really excited to get involved. It looked as a great opportunity for us to try to find some GPs who shared the same values as us, who were interested in providing good quality care to patients, and were keen to be part of a team as well. So when we recruited, when we first got involved and started interviewing some of the candidates, it was fantastic to see how they really valued the NHS and were really excited to work in the system. We've been very reliant on locum doctors who provide a great service but don't have the continuity of care for patients. Because they're not here every day, they like to go to different practices and do different things. So the great thing about these guys is that they want to be part of a team and provide continuity of care for patients.
I think the most rewarding part is when I manage to put a big smile on my patient's face. I really enjoy looking after my patients. I really enjoy and I feel satisfied when I see that the patients are confident, they are smiling, they have the care that they need to. I also enjoy working with everybody in the surgery. I love the staff, and the fact that I love going to work in the morning, it's everything for me.